I think having bipolar disorder affected my career quite profoundly. I sort of created a pattern where I would work in a job, quite happy in the job, and then I would either suffer an eye, which I'd get embarrassed about, and find myself difficult to go back to work because my behaviour was embarrassing, or more common, I would get profoundly depressed. For 12 months, 18 months, I'd be performing at eye level, and then I'd find myself unable to do the most simplest of tasks, That would be the first sign of depression coming on. Work would build up. I'd know I was depressed, but actually would put the depression was caused by my failure to do the work, rather realising that the failure to do the work was caused by my depression. So I would then look for an out. I would normally leave work, seeing that I failed at another job, and then find another job, or even think that I failed at that particular career path and change career paths. CV looks for bombs dropped on it. The suspicion I might be bipolar actually came from work. They actually sent me to an occupational health person, and she said, I can't diagnose you, but I think you should go to the doctors and ask them to screen you for bipolar. I started looking at some of the sort of online quizzes you get from Mind and the NHS Direct. It wasn't just a case of do 12 of these 24 factors affect you. It was a case of 24 factors sounded like me. I think post-diagnosis, one of the most positive things that happened was attending the bipolar education course run by Cardiff University in Bipolar Wales. It was the first time I'd actually been with other bipolar people. It was so liberating finding people who suffer from the same illness as yourself. I think the constant message that you've got an illness, not a character for, was particularly important for me at that point. It was only about a year after my diagnosis, and I was, in my mind, even though a rational part of me accepted bipolar, this part of me that sort of still doubted whether I was bipolar or not just lazy, talkative or whatever, that there was still. But then seeing a bunch of people whose life stories were similar to your own was comforting. Some of the techniques didn't particularly work for myself, but were very powerful for other people. So you take from it what is rewarding, use what is useful, and I found it very, very good. The most disruptive part of depression is the lack of self-worth if you're doing it, that carries on outside of depression. Even after you come out of the crisis, you can blame yourself for both being depressed and the actions that have arisen whilst you've been depressed, or the lack of action that have arisen while you've been depressed. The fact you haven't finished that project or that coursework or that ambition. Depression can make you view your life as just a chain of failures linked together with short pieces of normality. And perhaps maybe because I'm depressed, but I actually do seem to see the failures more than I see the achievements. Part of the advantages of going on the bipolar course was that you had the shared understanding that when you said depression, you knew what they meant by depression. You knew it wasn't going to be judgment there, It did help me to see some of the achievements I'd done within the illness. The fact I did work and have worked most of my life, achieved some decent things within work. The fact I did manage to finish my degree, even though I didn't finish school. I think that was another positive thing, again, to come from the course. The fact that it helped me to reflect on my life. Putting in context, I could actually see greater achievements than I did failings for once in my life.